Most of the people are confused between the sciatica pain and the piriformis syndrome. The reason is that the symptoms of the both condition are same. The pathology is same, but the etiology is different. Pathology is same mean in both cases the sciatica nerve, which is the biggest nerve in the lower body, is affected, involved, and get inflamed. While the etiology is different because the reason of the inflammation, the reason of the injury of the nerve is different. The sciatica usually occur in the old age or elderly people, usually in the elderly women. It's the reason is the direct injury to the backbone or spine, or the herniated disc because of the osteoporosis, or because of any fracture in the vertebrae, or it could be because of the spinal stenosis. While the piriformis syndrome usually occur in the young people and middle-aged people, the reason is that the piriformis muscles, which is the deep muscles in our butt, in our hip muscles, and it get these muscles become inflamed. There is a swelling, there is inflammation, there is afterward there is a scarring that presses the sciatica nerve, which passes underneath that muscles. That's the reason this nerves become involved. The pain and the pain and the numbness and tingling is same, but in sciatica the pain or numbness or tingling start from the lower back, while in the piriformis syndrome the people usually complain that they have a pain in the butt, in the deep muscles of the butt. It goes down into the back of the leg up to the knees. In some condition it goes up to the toes or the back or the sole of the feet. So that's the reason the etiology is different, the cause is different. In piriformis syndrome, this is the muscles which is basically the external rotator of the hip joint. Like this movement is because of these muscles, and it is a very deep muscles. It starts from the lower part of our spine, and then it take a round. It goes on the side of the bone, which is a greater trochanter of the femur of our femur, or the biggest bone of the body, and where it attach. That's the reason the pain start from the glutes. What are the common causes of this piriformis syndrome? The piriformis syndrome is usually because of the improper lifting techniques, and because of the stairing climbing, continuous basis on the climbing the stairs. It could be because of the running long for a long period of time. It could be because of walking as well. It could be because of the prolonged sitting. The people who have the sitting job and they sit for a long period of time, they also get this problem because of the stiffness and spasm of these muscles. So these are the most common causes. The other causes could be the direct injury of the muscles. That could be because of any accident, improper posture, like if you sit for a long period of time with the slouching, then it causes the pain. If you cannot maintain the good posture during the sitting, it could be the main reason of this piriformis syndrome. The lifting technique is also very important. So how you can treat this condition? The treatment is usually, piriformis syndrome is usually resolved within 4 to 5 days. So after 4 to 5 days of rest, it could be improved. But in some condition, when the muscles get severely inflamed, then it can take more time. And if you don't treat or don't reduce the inflammation, there might be the scarring, and this nerve can be involved for a long period of time and causes the long time symptoms that could affect the quality of life of the pupil during standing, sitting, even walking, and even during the lying. So the treatment is the rest. The treatment is the stretching of the muscle, strengthening of the piriformis muscles. The treatment could involve the physiotherapy, massage therapy, simple painkillers, etc. But the important thing